Coherinet TV, the Community Health Rights Network.
Well, a very good afternoon to you all. My name is Nzare Manuela. I'm a presenter on Coherinet TV. This is the Building Bridges program where we get to have a lot of people coming on board, where we get to interview them, we get to interact with them and get to know how they feel about sexual reproductive health. And today with me, I have Madam Naluja with me. Madam Naluja, how are you feeling today?
I'm okay, dear. How are you?
I'm fine, thank you. Well, I'm made to know that you are a community field officer with Coherinet, the Community Health Rights Network. I would love to know how was it being moving to the field, getting to interact with people in the community about sexual reproductive health and rights?
Thank you very much. But now, I cannot tell that it's hard now. But at the beginning, when we are beginning with the Coherinet, it was a disastrous. When you talk about sexual reproductive health, people did not want to hear about it. They thought those are secrets. To talk about sexual reproductive health in the public, amidst 3 to 4 people, they think you are a spoiled person. So they thought those things have to be spoken when you are behind the curtains. But right now, they have come to believe that you can talk about everything to people and to address anything accordingly concerning sexual reproductive health.
Oh, that is very fine. And then I know it is not an easy thing moving in the field, talking about sexual reproductive health, family planning, and abortions in the community. So how have you been maneuvering your ways? How have you been moving? Or maybe how have you been overcoming those challenges in the community?
It had not been a very easy way for me concerning abortion. You can talk about family planning. People have become to agree and believe that they have to space their children. It's their rights to have children which they have planned before. But the abortion is very, very, very. They still think it is illegal, but yet they end up getting unwanted pregnancies. They end up getting unwanted children. So you see people coming in the dark at night to ask for help. They don't want anyone to know they've come for that help. So they still think, well, how can I bring it? In English, maybe it is very hard. What about in Uganda?
It's okay.
Okay. Abantu boyogera ku bya sexual reproductive health bawuliranga kyesittaza. Bw'okyogerako olabanga omwononefu atalina kubyogerako. Naye ate bw'ojja n'oyogera ku family planning, ekyo bakitegeera nti oba omugambye ku spacinga abaana, kuzaala abaana bajja okusobola akuwa n'obudde. Ne bwe kituuka ku abortion, ate batya nnyo beekanga. Abasinga bamanyi oba omenya etteeka lya Katonda ng'okugyamu olubuto kubakutta. Naye ate era ba ending up ng'era bazadde abaana batayagala. Era bafuna embuto ze batakola ki, ze batayagala. Kati nosanga nga you just do awareness, community awareness. Now people are coming at night when they are hiding to get that service, yet they tell you, I don't want anyone to know that I've done this.
Thank you very much, Madam Naluja. What are your last words to the people listening out there, to the people viewing us today? What should they know?
Abantu abatulaba kati abali Coherinet TV kye baba bamanya nti ekibi tukyogerengako mu public nti ekyo kibi lwe tujja kisalira amagezi. Let us agree and access that this is a problem and we look for as problem solving, not than ignoring the problem, yet the problem still is there. Kati abantu bategeere nti ekizibu tukirage ensi nti kino kizibu tukyogereko tukisalira amagezi kuba Coherinet yali etandika yatunulira nnyo abaana baana baddukanga mu masomero, abaana baagobwanga, abaana naabulwa jjadde we baamukutte yamufiiriza olubuto taata maama. Kolineti neeyingiramu abo naye kati osasanze nga n'abafumbo bayenda ne bafuna embuto ezitali za mmaka oba ze batakoze eki ze bateeyagalidde. Kati kisaa kituuse twogere amazima, ekituufu tukyogereko nti kituufu, tukisabe nti kizibu, tukisalira amagezi. Pozi n'ekira kye neebaza nti Kohenret amaanyi ge yateekamu, nze kati ebitongole ebintuukidde nga byogera ku sexual reproductive health ate biweze. Mwe muli ne bannamateeka, kati ne Naguru Teenage Center yampise ejjo nga naye eri ku guideline eyafulumye sexual reproductive health in adolescents, nga bagali tuba tugenda mu masomero be tuba tukozesa okwogerako eri abaana ku early pregnancy, ng'olaba nti olugendo Kohenret lwe yatandika luliko abatandisa oddulaba nti ne gavumenti yalulabye ne tukodukolera guideline. Ze mba nkyebaliza Katonda kati community ewengayo obudde okumanya ebyobulamu, baleme kulindanga kulwala musujja naye n'ebyo byonna biri mu byabulamu. It's part of health.
All right, well, thank you so much, Madam Naluja, for having been on the show today. We hope to have you some other time. Otherwise, have the best of your time. Well, the program is still continuing. We still have more other programs coming on. Let's keep tuned.
Coherinet TV, the Community Health Rights Network.
Welcome back from that brief break. We're still continuing with the Building Bridges program. With me right now, I have our professor with me. As being working under civil society, what is your take about sexual reproductive health and rights, Mister?
Sexual and reproductive health is an issue that is very important because many conditions, there are many conditions that cause morbidity that is suffering, and also sometimes can lead to death for women and sometimes men. They are related to sexual and reproductive health. And the other reason why it is important is that there are many factors which lead to these disorders from the community. And once these issues are not addressed, they can affect, for example, if they affect the girl child, then can continue on and affect her during pregnancy, can affect her even afterwards. So it's an important issue that cuts across, and for women it can cut across the whole lifespan of the woman. So it's an important issue that needs to be addressed.
Well, working with Awogu, what is your relationship like? What do you feel about your relationship with Coherinet?
Yeah, I think Coherinet is one of our important partners. For instance, we have in one of our projects, we have several civil society organizations that give us advice on implementing projects on access to safe abortion and post-abortion care. So Coherinet is one of our important partners. Secondly, we have tried to write several projects together to seek funding together. And thirdly, there are many projects where they have invited us as partners to conduct with them training or evaluation of programs. So they are important partners for us as AOGU.
Well, Professor, what do you think the civil society can do better for us to realize sexual reproductive health justice in Uganda?
I think civil society organizations need to work together, to collaborate and to network, because they are addressing, first of all, is the same or similar problems. So they need to work together in designing programs that can address sexual and reproductive health. They need to learn from each other and to identify solutions that are practical and can work, and they need to implement together most of these projects. And lastly, they need to establish more collaborations whereby the best practices which are implemented by one organization can be taken on by another organization. In that way, they'll be able to bridge the gap in reproductive health access and services.
Professor Kaye, is there something last that you have to say to our viewers out there?
Yeah, I think it's this Coherinet and AOGU have a good collaboration, and it's important that similar collaborations can be established by Coherinet with many other organizations with the ultimate goal of improving access to sexual and reproductive health for women in Uganda.
Well, thank you very much, our viewers. It has been Professor Kaye with us.
Coherinet TV, the Community Health Rights Network.
Well, welcome back, our viewers. With me here, I have
Dr. Moses Okello. I work in DKT as the Programs Manager at DKT Uganda.
Thank you, Doctor. I would really love to know a few things from you. I would love to know what are some of those challenges, or maybe what are some of those gaps that you get to face as far as access to the sexual reproductive health commodities are concerned.
I think the challenges are structured in 3 levels. At policy level, you look at things like the policies are not very clear, so you have to realign policy to ensure that there's commitment from government for commodities to reach the last mile. Then secondly, at facility level, there are 2 components. One, there's a skill set, and then access to actual commodities. So that's also a challenge. And then finally, at the individual level, knowledge is a big gap. So when people don't know, they will not ask. So they need to be educated and given the right information for them to ask for what they actually require.
Well, what do you think can be done to bridge the gaps of access to the sexual reproductive health commodities in the communities?
I think for now, governments and organizations must invest in knowledge. That means you invest in behavior change communication, whether it is through radio, television, or community dialogues. So that's a primary point. Once people are knowledgeable, they will go and ask.
Well, what do you feel about your relationship with Coherinet as DKT International?
Coherinet has its strengths, and one of the strengths I see with Coherinet is that they are deep in communities. So as DKT, we feel empowered to work with an organization that has deeper roots in the community. So they are able to give knowledge, but they also to educate communities on how to access the different commodities through our different channels, whether it is clinics, public facilities, or through drug shops or pharmacies.
Well, Doctor, could there be something that maybe you want our viewers out there to know?
Yeah, I think from our perspective and from the perspective of the ministry, we understand that 57% of Ugandans first access healthcare through the private sector. So my emphasis is that let people get to health facilities, talk to trained healthcare professionals, and then they will be able to get the products that they need.
Well, thank you very much, Doctor, for having been on this show. Thank you very much, our viewers. Let's get back.
Coherinet TV, the Community Health Rights Network.
Guest with me here.
Yes, my name is Suka Jonathan Chisto. I work with Voda Uganda as the project officer.
Well, thank you so much, Mr. Jonathan, for having joined us for this program. I would really love to know, being a partner organization and doing similar projects with Coherinet, how do you feel about your relationship with Coherinet as Voda?
In fact, as Voda, we are so much appreciative for what Coherinet is doing. Our working together with Coherinet has helped us to learn a lot because we've always met and share ideas on how best can we reach to our communities. The fact that Voda is working with the first person, because it is a community-based organization, as we interact with Coherinet, we learn a lot on how to work with the communities, especially on issues related to sexual reproductive health. And this has enabled us to reach out to many communities, and now we've been able to disseminate information related to sexual reproductive health within different categories of people.
Well, what do you think the civil society can do best to advance the sexual reproductive health rights in the communities?
First of all, the civil society should embrace strengthening of networking they should work hand in hand with this. This can help them to share a lot, especially in terms of knowledge and resources. Again, the civil society has to empower the marginalized groups, because issues related to sexual reproductive health in most cases affect the people who are at the grassroots. So if these people are empowered, they will be able to make informed choices in regards to their sexual reproductive health. So I would encourage civil society organizations, first of all, to strengthen their network, their partnership, and again to ensure that the first person is empowered with information that can help him or her to make informed choices as regards to his or her sexual reproductive health aspect.
Well, thank you so much, Mr. Jonathan, for having joined us for today. Thank you so much, our dear viewers. Keep tuned to Coherent TV as we wait for the next coming programs.
The Community Health Rights Network.
Well, it's still the Building Bridges program continuing. I'm having a guest with me right here. Yes, madam, could you just introduce yourself to our viewers a little?
Okay, thank you so much. By the name, Superintendent of Police, Auma Lucy. I'm from KMP North in the Office of Child and Family Protection Unit, /Gender.
Thank you so much, madam, for having joined us. I would really love to know, what do you think the civil society and the police liaising officers can do together to realize sexual reproductive health of the vulnerable people in the communities?
Thank you so much, madam, for that question. Police and the civil society, they really have a big role to play to ensure that the vulnerable women, the girls in the community can access justice. First of all, we need to begin by conducting or carrying out massive and aggressive sensitization to empower our girls and women who are in the community. And we can only do that through empowerment. Number one, we need to empower our girls on their rights, because when they know their rights, they can go and report any kind of violation on them. They will go and report it to the responsible organization or the civil society. Number two, we need to sensitize our girls and our vulnerable women so that they are aware of the available services that are nearby. For example, we might be having the health center, but they are not aware that when they go to the health center, they can get different services like on family planning and how to take care of their reproductive health. So when we sensitize them, they can go there and they get all services, and that one would help in managing their reproductive health. And not only that, we also need to counsel our girls and women in the community so that they don't give up amidst the challenges that they are going through. There are some who have been defiled, there are some who have been raped, there are those who have already lost hope. But when we talk to them, we counsel them, they would know this is not the end of their life, there is still another level where they can go. So we need to encourage them, we need to counsel them. So we need the counseling services all to be around. Not only that, we also need to make follow-up on those cases from the community. There are those who have been counseled, but we have left, we don't know how they are coping up. So we need to go down to the community, we make follow-up on those girls and women so that they get all the different services that are available. Thank you so much, madam.
Well, thank you so much, madam, for having shared with us your view on as far as sexual reproductive health of the vulnerable people in the grassroots community level is concerned. We hope to have you the next time again. Well, thank you so much, our viewers. That has been Madam Awuma, a law enforcement officer, giving us her view of what she thinks about what the civil society and the police liaison officers can do to ensure that the vulnerable people in the communities get to have access to sexual reproductive health services. Thank you so much.
Coherinet TV, the Community Health Rights Network.